Well, hello, everyone. I'm going to kick us off and then I'm going to turn it right over to Dr. Ngozi Ezike. I'm Rachel Maruzar's Chief Development Officer for Sinai Chicago, and we are thrilled to be here and give all of you the opportunity to hear from Sinai Chicago's President and CEO, Dr. Ngozi Ezike, about health data and health equity. When we talked with the board of directors from Chi-Hacknight about our work around investing in health data capacity and technology, and really using those investments to drive health equity on the city's west and southwest sides. We were so thrilled to be invited today so that we can share with you the potential and the possibility that investments in better data access, better data infrastructure, and better technology within healthcare on our west and southwest sides can do in really advancing health equity for our communities. I'm delighted to introduce my boss, President and CEO of Sinai Chicago, Dr. Ngozi Ezike. You may recognize Dr. Ezike. She has been President and CEO of Sinai since June 2022, so happy anniversary this year. Before that, Dr. Ezike was director of the Illinois Department of Public Health, especially in leading our state through COVID and just really being a champion for all of our state's health, including our most vulnerable communities. Before that, Dr. Ezike spent 15 years as a physician and as an internal medicine and pediatric physician in particular with Cook County Health. And she's dedicated her whole career to advancing health equity for communities that need it most. So with that, I'll turn it over to Dr. Ezike.
Thanks so much, Rachel. And thanks again for having us. It's really an exciting opportunity to be before you virtually and share about the incredible work that I am so honored to lead at Sinai. As Rachel said, I went into medicine because I wanted to serve, and coming from a really under-resourced community in South Central Los Angeles, I always thought that I would either go back and serve in South Central Los Angeles or be in similar communities. And that's what I've kind of been consistent about, because I really do feel that healthcare is a right for all. And even though I hear that said a lot, I think in practice, that is not actually what is the result. And that's so obvious when you look at just even the communities that Sinai Chicago serves, that there's literally a 15-year death gap between the residents of the communities we serve and just heading into the downtown region, which is just a couple of miles away. And so trying to make a real difference, to say that it should be your genetic code and not your zip code that determines your life expectancy, we have an opportunity to do things to make that, to change that around. And we think that there are a lot of other people that believe in that too, and they need to understand how Sinai is working to combat those inequities and disparities. And, as people learn about what we do, they're going to want to be a part of this important work and mission.
So I know we have a wide diversity of people who are on the live stream tonight. So Dr. Ezike, just to start things off, will you talk a little bit about Sinai Chicago for those who may not be familiar and who we are?
Yeah, well, I don't want to be this well-kept secret. Like, Sinai Chicago is an incredible gem. It's been around for 104 years. This is the 104th year. It was originally founded to have a place for Jews to be treated and for Jewish doctors to have a place to practice. And obviously the communities have changed over, and now it's a place where like 90-something%, Latino and African Americans get their care. We're a safety net, which I don't know if that term means something to everyone, but safety nets are hospitals that take care of everyone. We are, we don't turn our close our doors because people can't afford to pay. It is a thing to do wallet biopsies in some places where, based on what insurance you have or don't have, you may be cared for or not. But we've always had the mission to care for everyone, regardless of ability to pay. And in fact, we were just highlighted a month ago by the Loins Institute for being one of the top 25 health systems in the entire country in terms of their percentage of charity care, giving back to the community, uncompensated care, really helping the most vulnerable in our society. And so that's a mission I'm so excited to maintain. And so I think it's laudable and it's worthy, and it's really the way that we're going to get towards true health equity.
Can you speak a little bit more about the communities we serve specifically? Who are they today? When we talk about health equity, what does that mean in terms of the communities we serve?
So again, it's 94% African American and Latino. When you look at the indices for the city of Chicago and the 77 neighborhoods, our hospital campuses are anchored in the communities that unfortunately have the lowest indices, whether it's the lowest rate of employment, the lowest rate of stable housing. We have the highest number of percentages of individuals who are, re-entering from penal institutions. Again, we have not even 5% of the people have, commercial insurance. It's 67% Medicaid, which really is, the lowest tier of our, tiered medical insurance system for our patients who don't have as much means. So we really are taking care of communities that have been underinvested in, that are under-resourced, and really those individuals often have the most severe disease burden because of lack of access, because of not having paid time off, not being able to take care of their health needs because of so many competing priorities. Those are the communities that we serve that really need it the most, and that we are really trying to shrink down those really unfortunate disparities and gaps that we see currently.
Well, in Sinai Chicago, across our network of hospitals and clinics, serves over 100,000 people every year, which is tremendous when you think about the number of lives we touch and the number of their families' lives that we touch. And we do this through a network of hospitals and clinics and community institutes. We have 3 hospitals: Mount Sinai Hospital and Schwab Rehabilitation on the west side. We have Holy Cross Hospital on the southwest side. We have a network of clinics across the west and southwest sides. We have Sinai Community Institute, which provides social services and community outreach and has for 30 years. It was so awesome to celebrate their 30th anniversary just last weekend. We have Sinai Urban Health Institute, which is a community health research institute that really invests in bringing the best of epidemiology, the best of innovative health services and community health worker models to really help look at how do we advance health outcomes and really address the needs of patients that face the greatest barriers to care. And I know not just from your time at Sinai and from the state, but especially from your time at Cook County, personally how much our patients face barriers to care that so many people may not understand. I would love it if you'd be willing to share just a little bit more on the personal level of what that means for our patients.
Yeah, so I think it's really important to highlight and to recognize for people who may not recognize that really what happens within the 4 walls of a hospital or a clinic is really not the majority of what determines your health outcome. In fact, if you try to partition out how different factors play into your health outcome, those interactions with the formal medical system maybe only make up 20%, but your access to education, transportation, having a job, having stable housing, having grocery stores in the community, all of that together are actually more important than the time you might spend with a doctor. And so we understand that at Sinai, and for over 30 years, we have taken care of people within our walls and very well. We have our trauma level, the highest level of a trauma center. We have the highest level of the NICUs for those super tiny babies. We have 2 1-pounders in our neonatal ICU right now, but we also know that there's other things that have to happen. And so whether that's helping provide transportation to the clinic, understanding that, you could look at a chart and say, wait a minute, this person hasn't showed up for multiple appointments. Why is this person not prioritizing their health, but not appreciating that, not everybody has a car or two sitting outside their home. And so when they can't find a ride, that also means they can't get to their doctor's appointment. It means that why is the diabetes so out of control when I told them that they have to eat right, but you don't understand that there is literally no grocery store in the neighborhood. And so trying to address that and bring, food trucks and try to bring fresh produce, bring farmers markets once a week to the neighborhood so that people have an opportunity to have the fresh produce that we are encouraging people to use to optimize their health. So really trying to attack health, if you will, from all of those angles is what it means to incorporate all those social determinants of health and understand how important that is to the health outcomes that we're seeing.
Well, and it has been so inspiring to work with you toward this vision, and it's been so inspiring to work with Sinai Chicago toward this vision. I imagine we've got people on the live stream tonight who are wondering, okay, this is great, but what does this have to do with data? What does it have to do with technology? Why are they talking with us about health equity? I mean, obviously, this is an audience of people who care. So can you talk a little bit about why we would be talking about health data and why data technology matters in a healthcare setting?
Yeah, no, super important to bring it home to this audience. One of the biggest opportunities, everyone knows that, technology can solve a lot of ills. And really, we want technology to be used to also help us get at these health inequities. And so when we think about the care that's given, we know how important data is. I mean, think about it. You can't really solve a problem that you don't know exists. And so if you don't have accurate data collection, if you don't actually have the up-to-date electronic health record that can succinctly pull out key pieces of data so you can look at the health of your population, that you can understand and say, wait, we have all these people from this zip code and we're seeing higher rates of asthma. Like, could there be something happening in that community? We think that homelessness really ties into difficulty with controlling your chronic disease. But if you don't have the data to understand how many of the patients that you're seeing with diabetes, actually are homeless, to be able to make those real connections, like that's actually how you can get the data to go on, whether it's policy implications. One great example is, culling the data. We were able to look at all of the women who died related to childbirth, maternal mortality. And as we look at that data, we saw that disproportionately Black women were 3 times more likely to die as a complication of a pregnancy. And so digging through the data, you see that, wow, a lot of these women who are in their biological prime in terms of having kids, in their 20s, 30s, 40s, they were dying not within the quote postpartum period, which is the first 6 weeks after delivery, but much later on. And knowing that Medicaid, which is the insurance that most of our community members have, Medicaid was ending at 6 weeks, saying that, oh, after the postpartum period, you lose your Medicaid if you didn't qualify for it before, and off you go. And so showing that most of those deaths were actually post that 6 week period, that allowed us to make the claim, and Illinois became the first state in the country to expand Medicaid for pregnant women for the full first year after delivery, with the thinking that if those people had their continued insurance and continued access, problems and complications that they were experiencing, they could have gone to the doctor and hopefully there could have been an intervention instead of the unfortunate death of a young person shortly after giving birth. So we know that data collection is important. We know that patients need, many people probably on this Zoom have the MyChart app on their phone, and they can quickly look and say, wait, when was my last appointment? When was my last, weight, blood pressure, whatever lab test. And we want that kind of transparency and that kind of access to reach out to your caregiver, be able to try to schedule an appointment. We want that same access because we know that that helps people take charge of their health, which ultimately would lead to better outcomes.
It's so clear to me when I talk with our colleagues, physicians, nurses, medical assistants, even community health workers, how critical having this data in hand is, and how important it is for the leaders of our healthcare system to make better informed decisions, for doctors to make better informed decisions right on the front line. And Sinai Chicago is in the process of making a really significant investment in our capacity to drive health equity and improve health outcomes in our community through data and technology. Can you talk a little bit more about that?
Yeah, so to get this data and to be able to have our patients have their health information in the palm of their hands, to be able to allow doctors to see other care that was obtained at other institutions, so you can see the trends versus seeing, not repeating, tests and subjecting people to, iatrogenic complications. We're looking to upgrade to what is, best in class, to the new Epic electronic health record system. And so this is a major undertaking. It's probably the largest financial investment that Sinai Chicago has ever undertaken, but it's something that will really help bring us into where we want to be in terms of what we want to provide to our patients. And so we are going to be transitioning to that just later this year. It's a wonderful and appropriate undertaking. And, we're really hoping that we can transform healthcare with the benefits of having this modern technology and all the benefits that it will bring with it.
Mm-hmm. And what are some very concrete ways that we hope this will transform our quality of care and transform our patient experience in ways that will advance their health?
Yeah, so a lot of it is, being able to streamline processes. There are a lot of protocols that are research tested and proven that are the best ways to do things. And with an updated EMR, you can build those processes right into the workflows, that when this person, is identified to have, a myocardial infarction, here are the steps that have to happen. This will happen. These tests will be done. This study will be done. The nurse will do this. When those things are just set automatically, you have less deviation and you have standardization, which ultimately results in better outcomes. And so we want to be able to standardize all these processes for these, common afflictions that people come into, so that we're giving the best in class care, the standard of care, so that there's less room for for any medical errors and the like. And then being able to go back into that data and monitor, having the different metrics that are captured that you can study and identify where there may be opportunities so that you can improve your care as you do audits and are continually looking at that data for opportunities for improvement.
Awesome. And again, we serve over 100,000 people a year across the West and Southwest sides. What do you hope, Dr. Ezike, that we'll be able to say about the health of our patients and their families and our communities? Because we serve so many people on the West and Southwest sides, because we're making this transformational investment in our data and technology capacity. And what would be your hope for similar organizations to make these kinds of investments?
No, I mean, I want, whether you live on the South Side or the West Side or Streeterville, that you know that when you go in for care, that you are just getting, the best in class, that you're getting the appropriate standard of care. We want to be able to offer everything that someone would get at a more resourced hospital. We want to be able to offer it in your own community, where you don't have to drive out of town or get rides, miles down the way, when you should be able to get that here. We want you to be able to, if you have that preemie baby that's in the NICU, that, you have that baby in the community where you can easily visit your baby every single day without the extra work of trying to get out of the community a bus or two to get the care that you need, or to follow up on your growing baby in that NICU. So we just know that this digital health transformation, and that's not overstating it, will allow people to care better for themselves. We have so many chronic diseases that are unfortunately much more advanced in the communities that we serve. And so we need people to be empowered, to be able to monitor and track their situations, to be a partner with their clinical team in identifying the right treatment plans that will advance their care. So ultimately, we can, again, narrow those life expectancy gaps and have people all live, to the fullest of their health, and really maximize their health and wellness. We know that health is wealth, and so being able to capitalize on that and give people the best health, that benefits, I think, the whole community and ultimately our whole city. I always say, a rising tide lifts all boats.
Right on. So what help would Sinai need, and how can people on this call help Sinai create this vision of health equity in our communities?
Well, we're looking for business and community partners who are interested in supporting our work, who can think about partnerships that can be established, who want to share expertise, who can help raise our visibility and help bring other people who care about health equity, who want to help narrow this life expectancy gap, and think that they can bring through, donations or partnerships or new interests, give us some opportunities to be able to create this full vision of health equity.
Absolutely. And for all of our attendees and everyone who will watch after the fact, I will drop my email address in the chat. If you have ideas about ways to support, if you have wisdom to share, if you are interested in supporting our matching gift challenge, or if you have potential business and community partners that you think we should be talking to, we are looking to make a huge impact. And we know that having advocates, activists, champions, thought leaders, and people just talking up what we're doing is so critical. So I'll drop my contact information in the chat. So any ideas, any thoughts, would love to hear from you. Any final thoughts, Dr. Ezike, before we open it up for questions?
No, I'm just super grateful for the opportunity to engage with you this evening. it's inspiring. My son is one of you. He's a software engineering student, and I'm just inspired by obviously your smarts, but also your commitment to our city, that you're looking to see how you can use your expertise to better the city. And so I'm excited to have you help bring, the best of tech to make our city even stronger. And we're here, and we're excited to find ways to partner with you. So thank you so much.
So I'll turn it over to our hosts, because we're ready for questions.
Awesome. Thank you so much for the presentation. That was great. And there are already some questions in the chat. So to just dive in, let's see. Let's start with, is Sinai creating its own data portal, or are you drawing from the Chicago Health Atlas and other portals like the City Health Dashboard?
And I think that question is about external data as opposed to the EMR data.
Yeah, our data is from our patient base, the Sinai specific patient base.
Our hope, I will say our hope over time, recognizing the importance of data, is that there could be opportunities for us. And actually through our research institute, there are ways that we're already contributing to the city's broader data sets, not about our patients specifically, but our communities. But we know that all of this improves our ability to really better target care, and we want to continue to bring our researchers and our community partners together to also help make sure that we're contributing to the broader dialogue.
Yeah, your community, your network, and your research is yet another benefit that Sinai is providing to the region. Here's another question. Besides morbidity and mortality, what health outcomes are of particular interest in tracking with your data? For example, are you looking at health-related quality of life measures? And I think you started to talk about that, Dr. Ezike, a little. Can you talk a little bit more about that?
Yeah, there are lots of different, really a large number of things to follow. For instance, really being able to look at, we know a disease that's particularly prevalent in our community is chronic kidney disease. Chronic kidney disease is something that unfortunately follows very closely with diabetes and hypertension, which are also very common in our communities. But we see that in our communities, we have a much higher rate of chronic kidney disease progressing to end-stage renal disease, where people are on dialysis. And understanding that there are treatments that you can be on that can slow or halt your progression to end-stage renal disease and dialysis, we can see from data whether our patients are getting on those medicines. And so when you try to extract that data, that can be the signal to say, wait, why are there certain patients that are not getting these medicines that we know will stop this progression? So being able to track the use of medicines across all patients, medicines that we know are essential in certain diseases, being able to track if a diabetic patient is at the goal hemoglobin A1C, you can pull all the patients who have diabetes and pull their hemoglobin A1Cs and see what percentage of people are at goal. You can see people who have diabetes and say, how long has it been since they had their last hemoglobin A1C checked? And if you see, oh my goodness, it's been more than 3 months, can you have the caseworkers or the community health workers reaching out saying, it's time for you to come in to get your lab. So there's so many ways that you can look and parse out this data to really have it be a step in actually improving the health outcome when you can act on that data.
Awesome. Another one in the chat, what are the pain points or your concerns about the EMR digital transformation effort you've invested in?
I mean, it's a lot of work. It's a lot of work. We have a lot of, we've got the super users that are being trained. We have everyone who, in addition to their day job, has to do all these modules and training, because it is important that it's installed appropriately and that everybody is schooled up on how to use it well, because we've got to know what we're doing with it, or you won't get all that maximum benefit. So it's a heavy lift. It's always a heavy lift. I've done one previous transformation conversion. And so it's a lot of work now, and it's going to be, and, when you finally go live and say, we're switching off, this system and we're going to that system, it's going to be stressful. Like, people are going to say, well, I knew how to do this in the old system. How do I do it here? So we're bracing for just the, growing pains and change, which is always hard. But we know ultimately, we can see further down the road to know that this is absolutely the right move, and it will pay dividends both for the caregivers and the patients, and for our community. So we're just looking to kind of power through till we get to the light.
Let's go back a little bit and talk just a little bit more about the research. One of the questions that came across was, with the FDA's and other regulatory agencies' recent pushes for greater diversity in clinical trials, how does Sinai see itself contributing to improving access to those clinical trials?
Yeah, no, that's a great question. So what Sinai has is that diverse population that everyone is looking for. What we may not have are the people who are steeped solely in academia and doing that research. So the way that we're going to really get there is basically getting married to some of the academic institutions, who have the researchers, who might be the ones who have some of those grants or those research dollars, but us using our patients, because those are the patients that are being sought after, to make sure that they're not excluded for those trials. We do have some research studies that happen on site with our providers, but just not to the level where you can do the scale of research studies that some of our academic partners have the bandwidth to do.
Do you have a plan for how a patient community awareness campaign will take shape for this transition?
That's a great question. So we have been working with our Sinai Community Institute. Again, that's the community-facing arm that is out in the community, is literally in people's homes. We have our community health workers that anytime they're doing a home visit, they're also talking about this new innovation is coming. We have signs in all of our clinics and all of the hospitals. But yeah, that is a big part of it, to make sure that people know how to download the app and how to interact with this. And so we have to be very intentional about making sure that we get this out. We have videos, terminals in the waiting room that are going to be talking about how this should be downloaded onto people's phones, and how steps going through that. So it's a very great point that there's a lot of education, because technology can be there and people still don't avail themselves of it. And so there has to be more of our intervention in terms of the community health workers and the providers and the nurses and everyone really talking this up in these months right now, as we're leading up to it happening later this year, so that people are waiting for it and ready for it.
Let's stay on that theme for a second, on awareness and communications. Moving to a new electronic medical record system, it's extraordinarily expensive. Shocking to me how expensive it really is, and it needs to be paid for. What are you doing in terms of communications to the funder community, and how can some of the people on this call be helpful there?
Yeah, no, thank you so much. I mean, we are getting a deal, if you will, and it's still as a price tag of over $40 million when you think of all the new equipment and the training and everything that goes with it. And so, we are really fortunate to be able to, as we share the message of why this is such an important investment, we are looking to corporations, we're looking to foundations, we're looking to the city and the state for support for this. We've signed the contracts, and now, we know that we will get the support to make sure that we can, go on and cover those expenses. But we really need to find more people that believe in technology as a way to promote health equity, and who are willing to put dollars and individuals who can support us with corporate dollars forward. Again, I think Rachel mentioned that there is a $5 million donor who created a $5 million match. And so dollar for dollar, every dollar that's donated towards this digital health transformation will be matched by that donor up to $5 million. I think we've raised about $3 million. I think we raised about $3 million. So, but there's still $2 million, which will be $4 million to help towards to help towards this big effort. But yeah, so if you know people who say, yes, we're looking for ways to support the community through technological innovation, I think this is a very worthy project to consider, to lift up to someone who's so minded.
And anybody who has thoughts, ideas, suggestions, or even just questions, please feel free to contact me. Again, my email address is in the chat.
Awesome. All right. How do you balance using health data for research and any patient's privacy concerns?
Yeah, no, absolutely. So there's a way to aggregate the data so that you can get percentages of, what percentage of our patients have this condition, what percentage. But when we're actually the care team and we're using that data to reach out and say, wait, you haven't gotten your hemoglobin A1C, in 3 months, that's part of routine care, to be able to use that data to follow up with patients and make sure that they are, that they are getting all the care that they need. So on one hand, there can be data that's aggregated to understand the population health statistics. And then there's individual data that you're using to actually support that individual's care.
Great. We have another question on data. The question is, does your organization have a data science team? And if not, does Sinai plan to have one? And how does Sinai plan to take advantage of the new data in Epic?
So I think, I know we have our IT team who's going to help us maybe get some of those, extract the data, whether we're looking, depending on what metrics we're looking at. And then we do have a research arm of Sinai, which is the Urban Health Institute, or SUI, Sinai Urban Health Institute. And so we are actively looking at ways that we can make that data actionable. So now that we're going to have access to data that can be more easily culled, we have to decide what questions are we looking to answer, and which data will help us get there. And then looking at that, you can actually schedule or create interventions and then measure those interventions and figure out, if there are things that should be scaled. So I think the opportunities are endless. We do not have the full team of people in place, but that would be a dream, that as we have the capability with the full implementation of this, that we could also build out the team that could really help us capitalize on the learnings that are there to be learned.
Yeah.
Awesome. What type of data do you envision would be helpful to gather to inform interventions to improve health outcomes beyond analyzing data to just know what those gaps are? And then this person cited, for example, Epic Care Gap. And then I think the same person also added, show a patient is due for their mammogram, but how to know what the barriers are to them getting them.
Yeah, so that's where you bring all the pieces of the of the health system together, right? You're not just looking at, oh, they're missing the mammogram, but you also have caseworkers and community health workers that are reaching out to see, okay, we see you're overdue. You're supposed to have it in this month. We're 5 months out. And then, on an individual level, like first, I think there's a way to just send a blast message through that portal to say, hey, your mammogram is due, your this is due, your that is due. But then, as you send that out and see that you haven't gotten the response, that's when, some individualized approaches, via community health workers and caseworkers, that's how hopefully you get over the finish line from just knowing that there's a problem to being able to intervene to actually really address the deficiency.
Here's a question about how this, wonderful civic tech community might be able to work with Sinai. Are there any key questions related to health equity in Chicago that you think could be addressed using publicly available data that folks in this group could work on? And by this group, I believe this person means the civic tech community.
I'm sure there are many. I'm sure there are absolutely many in so many different realms. And I love that question and would love the opportunity to probably sit down with someone to think about which are the best ways that we could utilize an incredible resource like that. That's phenomenal.
Totally.
Okay, and I think we probably have time for maybe one last question. Let's see. Adam, I know you had some. Are any of your burning questions that we haven't answered?
Well, there is one left from the stream, unless you want me to go to mine.
I thought that one was sort of related to the question you just asked.
So let me ask mine. Sort of a parting question. Dr. Ezike, a lot of people know you from your time in running the state's COVID response. Give us one, maybe two key lessons that you, from your time in running that response, that you brought with you to running the region's largest safety net health system.
Oh, wow, that's a good one. So I know one is that you have to have the lens of health equity, or you can have the best technology, you can have the best docs, and you still won't get the outcomes that you want. I think one of the strongest examples I use is at the state, like there were federal guidelines that came down when the vaccine was finally available. There were guidelines in terms of who should get the vaccine first, because we knew it was going to be in limited quantity. And I know in just ongoing conversations with the governor, the thought was, it's probably best if we follow what the federal guidelines follow the federal guidelines, because deviating from it will invite so many questions like, why did you think you knew better than the feds in terms of who to give it to first and then second and third and fourth? And so the idea was like, if you to not rock the boat as much, you would try to follow the guidelines. And, the first tranche of people to get the vaccine were supposed to be the healthcare professionals. And that kind of made sense. You really need to have a healthcare team to support the rest of the community. And then the second was the long-term care residents in the long-term care facilities, just because of the devastation that had been seen and them being so vulnerable and them all being in this enclosed setting. And then the next set was supposed to be those who are 75 and above, that, the elders we knew were at greatest risk. And so it was there that I pushed back and was like, we cannot do it for 75 and up. And he was like, why? And it was basically simple that looking at our data, we know that people who are of Black background, Latino background, they are not often getting to age 75 if you just look at the life expectancy. So if you were to give the vaccine to that next tranche of people and start at 75, you would extend the gaps between those who were vaccinated, between whites and Black and brown people, because there would be fewer percentages of Black and brown people because they don't reach the age 75 as much. And so being so intentional and always thinking of people, especially the people who tend to have the worst outcomes, I think that was such a critical example that shows if you're not thinking of those who are often the ones who have the worst outcomes, and you're just thinking towards the middle or the majority, you will inadvertently extend those inequities instead of gapping them. And so really understanding that equity means thinking first of those most vulnerable, that's the mindset and that's the lens that I bring to the work at Sinai to ensure that we're thinking of how this will be laid out for those who are in the most dire situations. And then usually if you take care of that group, it works out for everyone else as well.
Thank you so much, Dr. Ezike. You really are a hero to many in this state. And the work that you're doing now is just as, if not more important than the work you had done prior. And I want to thank Rachel for organizing this and for spending time with us tonight. And Rachel, I have a favor to ask of you. Will you please spell out your email address for the video and live stream so that we know how to keep the conversation going?
Absolutely. Rachel Marusars at sinai.org. And I definitely have to spell both. RACHAEL period Marusars, which is M as in Mary, ARUS as in Sam, ARZ as in zebra, at Sinai, SINAI, you can see it right behind me, .org.
Excellent. Thank you so much. Well, I think without further ado, that brings us to our post-presentation part of the evening. So if you'd like to join us for that part, you can go to the link that's listed right here, bit.ly/CHN-remote-Zoom. And that's where the fun will continue. So please join us there. But in the meantime, we're going to do the thing that we always do in as much synchronization as we possibly can. So
1,
Adam,
2, 3, go forth.
go forth and